In this tutorial, we're going to give you a brief overview of the Sbar. We're going to discuss the situational background, assessments, and recommendations. So I'm going to start by logging in with your username and password. It opens up to Care Compass, and the patient that's assigned to me shows up. And from this window, I can launch into the Sbar. So Sbar stands for Situation Background, Assessment, and Recommendation. It tells you a little bit about the patient at the top, their name, age, any kind of isolation that they're on, why they're here. Each category has an arrow, and you can collapse them or expand them. Or in the right-hand corner, you can expand all or collapse all. We're going to start with situational background. We have patient background, which tells us the resuscitation status, whether or not they have advanced directives, what kind of isolation they might be on. Gives us some information on risks. We have a high fall risk score. Has their diet and a pain score. If it's underlined, we can launch into this window here and see our details of it. It gives you their past medical history, and it says there's one item here, and here it is. Shows their procedure history, and it shows what kind they are. Diagnoses, problems, and again, it's underlined. You can launch right into it. The diagnoses, their allergies. If there's a plus sign, you can actually add a new allergy. You'll just click back onto the Sbar to take you out. Flagged events are going to show up right here. It shows you that maybe they have an elevated temperature, your immunization status, and any medications. You can see this one's highlighted in red. It's due at 8 o'clock. And it shows you what their continuous drips are and any other PRN medications. It can also take you into documents or into your nursing documents, such as like some notes. The next section is the patient assessment. Your vital signs will show up here, all their height and weight measurements, and it'll start with their patient assessment. And it starts with pain and goes from a head to toe assessment. So you can scroll down. It starts from neurological, respiratory, cardiovascular, etc. Shows you how many items are in each. Scroll back to the top, and it goes to oxidation and ventilation and shows you your ventilation settings. Lines, tubes, and drains. Shows you your central line and your intake and output summary. Activities. And you can see that none of them are charted now. Your lab results. And diagnostics. If you click on the arrow, it will show you and filter out how many hours back you want to look at results. Your diagnostics would be your X-rays, EKGs, CTs, and etc. Again, you can see you can access your results here. You can collapse all your sections if you choose to, and just open the ones that you want to see. Your third one is a recommendations. You have your care plans here. So you can look, this person has a ineffective airway clearance, which is done, and there are a couple other things that are in process. The social history, quality measures if there are any, shows your overdue tasks. These would come from your activity view. Here's all the patient education. And here's a list of your orders. You can see that these are filtered out with the most recent at the top. And the dates go back as you scroll down. These are all the patient orders, and we have our discharge plan at the bottom, and any follow-up that's going to be required for a patient.